Hello everyone, my name is Caitlin and I'll be doing my discussion post. Florence Nightingale made an immeasurable contribution to the nursing profession, transforming it into an evidence-based profession with respect based on education, ethics, and social health. That's a citation from Turkowski 2024. Her work at the Crimean War demonstrated that sanitation, ventilation, diet, and close technique with the patient were all directly proportional to the patient outcome. The implementation of statistical analysis as a method of obtaining a correlation between the environment and the death rates by Nightingale was especially remarkable since it placed the data gathering and outcome attainment as crucial components of nursing practice. These ideals gradually appeared in the field of nursing, education, professional norms, and even in the structure of hospitals to reinforce the role of the nurse as a caregiver and astute evaluator of how the patient reacts to care. These and other factors, such as observation, documentation, and environmental control that Nightingale highlighted, are directly related to the modern evidence-based practice of inpatient care and community-based care. That's a citation from Matthews 2020. Her belief that quantifiable outcomes ought to dictate nursing is congruous with the new belief suggesting that nurses ought to assemble research, clinical judgment, and patient circumstances. The current practice reflects this legacy in quality improvement programs and protocols and data utilization as a routine. Even in her thoughts, Nightingale was a reformist herself because nowadays nurses are not only supposed to be guided by the rules of evidence-based practice, but also the trends of practice, as well as contribute to continuous improvement, which is even evident in her mindset. During my personal clinical practice in the neonatal ICU, I received the chance to notice that the precepts of Nightingale are most applicable nowadays. Infection prevention, such as hand hygiene and limited lighting, sound, damp, and body temperature control is needed to enhance the outcome of premature infants. The substances of an oxygen desaturation of a preterm baby were reduced with the preemptively notice environmental stress factors, as well as adherence to evidence-based sources on positioning and skincare in one experience. This practice reinforced my beliefs that the consideration given to the environment and methods observation by Nightingale was still a practice that forms the foundation of safe and evidence-based nursing care in the most specialized plants and units, like in the NICU. And then I will have my references listed below. Thank you.